My name is Brian Villa, and I have the honor of discussing our most recent project titled Geographic and Demographic Disparities in Firearm Injuries, a 33-year retrospective cohort analysis. Firearm-related injuries are a significant public health problem in the United States. The U.S. Centers for Disease Control and Prevention has identified that some communities are disproportionately affected by firearm injuries compared to other communities, but the definition of what a community is remains poorly defined. The Florida Department of Health uses county lines to delineate the borders of the trauma system service areas. Therefore, we use counties as the definition of communities. In this project, we utilized a free open-access government-based electronic health record database to conduct a retrospective cohort analysis of over 16 years of firearm-related hospitalizations and 33 years of firearm-related deaths. This represents over 123,000 injuries. We stratified these injuries by intent, defined unintentional and intentional, and the demographic categories gathered for all years, including sex and race of Black, white, and Hispanic. We then stratified these injuries based on community characteristics, including level of socioeconomic distress, ruralness, and the amount of concealed firearm carry permits. Using repeated measures ANOVA models, we assessed the rate of injuries over time, and through pairwise comparison of simple main effects, we assessed for inter-county differences. Over the past 33 years, firearm injury rates continue to rise, with hospitalization rates rising exponentially in the most recent years. We found that there was significant increase in firearm hospitalization rates in more distressed communities. This trend was not seen in firearm-related deaths. Larger counties were also found to have higher intentional hospitalization rates. Ruralness of the county and rate of concealed carry weapons permit did not correlate to firearm hospitalizations or deaths. Intentional firearm injuries greatly outnumbered accidental injuries. A commonality amongst all communities was the increased impact of firearm deaths on males in the community. A secondary outcome was exploring demographics within each community individually. This was performed through the formulation of multiple snapshot heat maps. While our heat maps confirm what is well documented in the literature, that Black residents suffer from higher rates of firearm injuries, several Florida communities see higher firearm injury rates in white and Hispanic demographics. We hope that from these heat maps, ACS-verified Level 1 trauma centers may tailor their preventative outreach programs to the population highlighted as most vulnerable in their specific community. We encourage readers to explore these heat maps in this edition of the Journal of the American College of Surgeons. Finally, I would most importantly like to thank the American College of Surgeons and the Southern Surgical Association for the opportunity to share our work.